There's another side of the equation that it doesn't matter how much money you spend if the very structure of the life that's been formed in your particular region of the world or of this country is such that the living habitat is unhealthy. The cultural habit matrix that you're immersed in, were trained in from you're young, is literally one that leads to disease. It doesn't matter how much you're spending on the healthcare system, a diseased population is going to cost a lot of money. A lot more money because a diseased population is going to seek care. They're going to come in for their headaches, for their migraines, for their irritable bowel syndrome, for their heartburn, their reflux, their swallowing problems, their anxiety, their depression, their brain fog, their fatigue, their cognitive impairment. They're going to come in and say, what can help me? And in the conventional medicine system, it most of the time is going to be a prescription therapeutic. Right? And so we're not actually getting to what's really creating poor health in our population. And so therefore, we've got enormous utilization rates of clinics, more people. And so you hear insurance companies, talking about access problems, and it's true that we don't have enough healthcare providers to serve the population at large, and that's about to get a whole lot worse, and the clinics are backlogged. But I'm like, if you just look at how conventional medicine is managing disease, getting into a doctor's office with your insurance card isn't necessarily going to lead to any better outcomes for you, one way or the other,
Yeah, it's just
whether
more
you
of the
can get in
same
or not.
thing.
Yeah, you'd be much better off if that insurance card actually covered an intensive health coaching program that taught you how to detoxify your environment, craft new habits, value food properly, and restore your body to a full state of health. And then you'd just be buying the heavy premium but not using it, which is where healthy people end up, paying a lot of money for the financial protection. That's only touching possibly at the surface of the question you asked me, but that's some of the aspects of why I think it's a problem.
But the thing that stuck out to me that you said is habit matrix. I think that's an interesting perspective to have. So how does your understanding of the habit matrix that people exist within inform how you clinically work with them?
First and foremost, someone who seeks me out for care. And it's a variety of subtypes that seek me out. Some of them are very healthy, high-performing types who are really into optimal fitness, optimal cognitive performance. They are successful. They want to be increasingly successful, and they're really just looking for every edge they can get in terms of making sure they're biologically healthy and optimized. So that's some who seek me out. But a lot who seek me out more they're not well, and they haven't been well for probably some time. And so they've kind of hit the wall. And it could be metabolic health problems like dysregulated blood glucose, diabetes, hypertension, developing arterial disease, et cetera, that whole subtype. It could be immune-mediated autoimmune and, fatigue and pain and all of that and inflammation. So it could be a variety of subtypes, or it could be all in, but they're coming in. And my first assumption, and for someone in that kind of state of health, is not that it can be, I want to be clear, that the body can get impacted in a significant way that shifts your compensating homeostatic responses into a state of disease by an exposure that you had nothing to do with, right? By unusual infection or an unlocked gene and your autoimmune disease expressed itself, or any other number of factors that could cause a person to actually keep gaining fat even though they're doing all the right things. So there are, but the most of the time, the reason for their state of health is going to be traced right back to their exposures in their environment and their habits. Like, I know that. That's my first operating principle, is if, we've got this deep toolbox of tools now in medicine where we've got, advanced therapeutics and peptides and technology and data. There's a lot of things we can do to modulate the human system, to catalyze transformation of biochemistry and physiology into possibly a healthier state. But if all we do is apply those tools, we might get some improvements, but the real underlying issue hasn't been addressed. And most of these people are good people that want to feel good. They've tried. They've tried to improve their diet. They've tried to follow some advice. They've tried to exercise, or they've worked on improving their sleep. Most have been trying and just not being able to detect any results from their efforts, both objectively through their measured markers of disease or subjectively through their sense of well-being. And so if we're going to help that person truly get, as much as possible, restore back to like an optimized homeostatic healthy state, that's the first goal. Can we get you there? And then if you want to go deeper into high performance, then we can push off into that as well. But if we can just, the body's a pretty high performing machine if it's just healthy. That's one thing already to know, right? Like the capacities of a healthy human system are remarkable. Cognitive capacities, physical capacities. It's amazing. Just do an inventory on what human beings have accomplished in our time on Earth from the time that we were hunter-gatherers. And it's clear we have enormous capacity. So just getting back to like a good, healthy state unlocks an enormous amount of performance that you can go deeper. But if we're going to restore the body, then ultimately we're going to have to identify the habits that are creating and catalyzing the problem and help people re-entrain the habits that are going to actually result in health. If we don't do that, we're going to fail. We're not going to arrive where we want to arrive. So my intake form, which has, family history, medical history, genetic history, blah, 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 medication, supplements, concerns, goals, has a long habit index, right? Like in all categories: stress, sleep, nutrition, fitness, drug, alcohol addictions. Like it's a pretty in-depth questionnaire that I read in very detailed fashion, because that's where we're going to probably dig in the most. The protocols are pretty easy once you're experienced in this. You're like, okay, we could use this immune peptide, and this is this. We're going to bring in this therapeutic, and we're going to do this to nutritionally optimize you. And here's your gut protocol. Here's how we do. That stuff becomes algorithmic once you've done it enough. The hardest part is helping that person reestablish how they're going to approach their daily life in a way that is health promoting rather than health eroding.
You start with the mindset, it sounds like. So what do you do that you feel like really helps people to get into the appropriate mindset for all those other things to take place and take root in order to improve their health?
That is a great question. I love this because and I'm not saying that what I do is what everybody should do. I'm just offering, again, my observations working in a clinic for a long time and measuring results.
Yeah, I'm just trying to figure out what's been successful for you.
Yeah, but as I've done honest inventories on like seasons where we've got phenomenal responses from really sick people, I had to step back and say, what's really working here? I've distilled it down to what I think is like the most important piece of the whole puzzle, so to speak, of how this person is going to. I think it's the most critical piece. People who've been chronically sick are wounded. They are. A lot of that sickness could be due, a lot of their habits and sickness can be tracked back to trauma, right? Unaddressed trauma. I'm not a trauma specialist. I don't do trauma counseling. That's not what people are coming to me, but we have to acknowledge that people who've experienced any kind of form of trauma in life, it can entrain thinking patterns that lead to behavioral patterns that are very hard to break if you don't go back and reconcile the trauma some way, shape, or form. So they're wounded, many are traumatized, and their self-conception is very poor because they're sick. They're chronically sick, right? They've got diseases, and they also possibly know there are things they should be doing in their life that could improve their condition, and they're just not able to get it going, and so they feel bad about themselves, like it's my fault. And many times in the health system, depending on who they've encountered, they may have been blamed, or their family has blamed them, or others look at them funny, like, what's wrong with you? Why can't you take care of yourself? And so these are beat down people, overwhelmed. And when they come to see me, we have a pretty lengthy first visit. And the first part of that is for me just to hear their story, and reflect back to them. Like, tell me your story of health. And what is the story you wish it was? And in the process of hearing it and reflecting it to them, there's some trust built with them. They're being listened to, they're being heard, they're being felt. You're sympathizing or potentially empathizing if you've shared some of the afflictions that they've been through. And that builds a trust that's critically important, because if they trust you, they're more likely to follow the protocols you designed for them. But then you know that because you've looked at their data, you've looked at their history, and you can't make promises because the body's infinitely complex, but you're pretty sure this is a case that we can get results. We can change this, right? You can change this. Your body can be back in a state of health. And you know it, and you're able to take their story, but retell it to them integrating the new story, the one they want for themselves, not the one you want for them. The one you want is for them to be healthy, of course, but
So
it's
what does
really
that
about
sound
what
like?
they.
A little bit more like how you would communicate with the patient specifically?
Yeah, I'd be like, it's hard to do it. I'm not really good at doing like drama encounters. It all happens real time, but it would be
Yeah,
something of the
yeah, yeah.
sort of, Micah, obviously these experience. It's going to sound fake when I do it, but this would be an example of how to
That's
do it. I
okay.
want to be clear. This is not going to represent probably because it's very natural and just flows out
Yeah.
of an atmosphere created of trust and deep engagement. And this is obviously not that that in that same way. But essentially, I'd be like, if we could go back and we could have changed this, and we could get this part of your body working better. So some of it's like scientific, like, hey, I know that, and again, depending on who I'm talking to, your cell membranes are probably tattered and degraded, and that's affecting this function and this. And you begin to explain to them how biologically the picture of the data fits body dysfunction. And you're not just being like woo woo. You're actually like saying, I can tell you what's going on with some degree of confidence in your body. I can tell you the story of your body as it is now and how it fits this perplexing narrative of what the heck's going on with me. What's wrong with me? Why am I so sick? My body is weak. It's frail. I can't trust it. I can actually help you understand that story with your data. Micah, it's very clear that you have a problem with what are called cell membranes, and they're integral, right, to the health of the cell. It's like ground zero of the health of the cell. Healthy membranes, the cell can't be healthy. Things can't get in and out. There's inflammation. This leads to immune system dysfunction. It affects something called your mitochondria. And if they're your energy factories, and if they're not functioning well, you're going to be fatigued. And then if your immune system's not working well, it can become unbalanced and overreactive. And then the gut, what's happened here with this, and that's why you feel the way you do. But all of that can be restored probably, right? We could actually begin to layer, like working together, you doing some things for you and me, so using some tools that we have that'll make this easier and helpful and catalyze the process. We could begin to restore the integrity of those cell membranes and begin to improve how those mitochondrial function, which will give you more energy. And we do have peptides and other therapeutics that could possibly play a role in rebalancing the immune system and turning off this excessive inflammatory response. And we can use a protocol to improve gut integrity, digestive function, gut biome, and we can clear toxicants from your body. And that the end result of that will be this version of you. Right? This version that has energy, that feels good, that's not depressed, that can wake up in the morning, that can engage in fitness. And I can tell you that version of you, once you're experiencing it, it will be so delightful to walk in that body, to have that experience of health. It'll be such a contrast to what you've experienced that your fear that you'll just fall back into your old self, you don't need to be afraid of that, because once you arrive at this new place, that won't even be an option for you. You won't even think of it, because what you'll be addicted to is being healthy. Right? And things that take away your health, you'll detect, and you'll stop. You just won't even bother. You won't continue to, as a proverb goes, go back to your vomit, right? Like you're not going to keep doing that anymore because you're not entrained that way. You're entrained to health. You're experiencing health, and I'm telling you that can be your story. And what they end up doing is they begin to become confident. They actually start to
Yeah.
gain confidence, right? Which is the big piece. That's what I was getting to: trust and confidence. If hopefully if you are on the right track and you can guide them where they need to go, and that's nobody's perfect, none of us are perfect. Hopefully if you are, and you're honest about your confidence, you're not going to just sell them a bill of goods. There are cases where I'm very like, I know your body can get healthier, but I just can't quite figure this out yet, right? Like, and we're going to need more time, and we're going to run experiments, and we're going to see what you respond to, and we're going to keep puzzling this out. And then there are cases where it's just such a clear pattern that you've seen 1,000 times that you're like, I know, right, exactly what we're going to do. But whatever the case, they trust, and then they have this confidence that it's not that their body isn't capable of being healthy. That it's just a lemon that they inherited from the time that they were born, right? Actually, no, it's designed, it's fearfully and wonderfully made. It has got the capability to express phenomenal health, and that confidence is empowering to them. And they actually will step out of the office and begin to do all the things you gave them to do. Both use the tools, which are complex regimens of therapeutics and peptides and detox and blah, 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 and say, hey, I've never had this many various supplements and things I had to do, but I don't care. I'll do it because I believe it's going to get me where I want to go. And you've told me to no longer eat poisonous foods, and you've given me an inventory of what that looks like. I'm not going to. I'm not going to eat poison. I'm not going to take myself backwards. You've told me to begin to filter my water. You've told me that I need to attend to my air quality. You've told me that you're going to start with this type of little bit of physical activity, blah blah blah. I'm going to do it, and they do. And then of course the results come, and then they gain more confidence. I know that's a very long answer, but
Well,
to
I think
me,
it's really good. Yeah.
yeah, it pivots
Uh,
on that, right?
Yeah, I mean, I think the trust is somewhat of a formula of clarity as well. I think what you're doing with the way that you described it is you're laying out the dysfunction. And kind of a little sidebar is I've noticed some people that are not coping very well with their environmental stress also feel guilty about it because they're doing the same thing that a lot of people are doing. They're, eating a normal, right? They're doing the normal things, but they're the ones that are sick, right? And so a lot of people will look at that and I think have some guilt around it, or they'll look at that and say, I'm pretty healthy. Like I shouldn't be sick. Like I do the things, I exercise, and it's like, well, but your body is not coping with the environment. And so that's kind of you wouldn't say that's irrelevant, but
Yeah.
I think what you're doing though is you're really giving the trust factor. There's a lot of clarity around what is the dysfunction. There's a lot of empathy in terms of you're reiterating to them what they've gone through, their story. But then that confidence factor really comes in when you start to tie it to that arc of, well, this is where we could go with this. And so, yeah, I mean, I know so many clinicians that really just get into, they geek out on all the tools and all the supplements and that kind of thing. But I think if a lot of clinicians did the front end work to really figure out these conversations, all their outcomes would improve.
I 100% agree with that. I think the outcomes that I've measured, which have been really, really good, almost perplexingly good to me over time. I ultimately, when I did the inventory to say, this is beyond the scope of my expertise, some of the results that I'm seeing, or this is beyond my power, my expertise, my skill set, or the power of the tools that I have, I really went back and I believe firmly that it all starts with that type of engagement we just discussed, which allows them to address the root problem, which is their relationship with environment and habit.
So we live in Western society, and within Western society, a lot of us are exposed to relatively similar things, the types of foods we eat, the pollution, the environment, the water, etc. So there is quite a bit of similarity between the population in the sense of we're exposed to similar things. So then that brings up the question, if we are kind of exposed to relatively similar things, and everybody has their own individual environment, is personalized medicine really essential then? And then if so, how do you fit that into your practice, and when do you start to really deeply personalize?
It's a great question. And there's actually a very pragmatic response to it on one angle. Okay, so with personalized medicine, depending on what tools someone's using, you know this, and our clinic right now will have a pretty good genetic evaluation. It's not full genome sequencing, which will be coming, and I think will be phenomenal. And we have at this point, what would be considered one of the better gut assessment tools. It's, better ones are coming. We have a good toxicant survey, a very good intracellular nutrient status survey. We have tests that give us a hint at cell membrane integrity and function, blood metrics, DEXA for body composition, bone density, carotid intimal medial thickness screening for endothelium, along with blood biomarkers, right? So we have an ability to really get fairly granular for an individual. And when we have that much data, we're able to really identify where is the problem for you, because genetically, maybe you just are just a rock star with detox. You really are. And you also, meaning phase 1, phase 2, phase 3, all of it just works great for you. And you don't really have a big toxicant problem. It's not where, it's not the lion's share. And so we don't have to invest as much money, and detox protocols are much better than they used to be, but they still take time and they take investment and they take work. You can really guess badly around the gut, and end up doing things that are harmful for it rather than helpful for it.
What would be an
And you can
example of
also,
that?
If somebody has, like a lot of times, if you're not looking at the gut, and again, I'm going to get around to the practical, like for those who don't get into personalized medicine, what could we actually do based on all this? But you might see in an individual that, I mean, there could be a case where there's very concerning markers of inflammation, including elevated chronic markers of inflammation like calprotectin and lactoferrin, and markers of gut integrity and immunity that could indicate a more serious ongoing problem with the gut. Not just, okay, we're going to put you on some colostrum and blah, 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 blah. Like maybe they're developing an inflammatory bowel disease, right? Or they could have neoplasm, or they've got some type of pathogenic infection, or a microscopic, lymphocytic colitis. These are actually disease conditions. This is where you've gone beyond a dysfunctional system that's affecting you to you've tilted into a disease state that might require stronger interventions to stabilize it. And you can still go back and try to restore the health. So you could miss important findings like that, but you could also end up thinking you're supposed to use this probiotic, and in fact, you didn't use these tools or this probiotic. I know this isn't about the Therium company, but I'm eager with the gut technology you're developing. I think we're going to get a lot better at that and kind of knowing where to move in specifically. The test I use is pretty good, but it's not great. But we can tell if certain species like Akkermansia are low or high, right? And, Akkermansia is a big target for metabolic health and as well as gut integrity. And so there are people who have entire protocols that they teach that they're just designed to improve Akkermansia more than anything else. And yet the person may have very robust levels of Akkermansia and not really need a protocol to actually improve Akkermansia. And so again, waste of time and effort. The nutrient assessment. Some people will need some support, but not other support. And oftentimes the blind spots are pretty profound where that person is, and you're able to target it in. So my point is that you're able to get a more precise mapping of that human system. You're able to build a better model in your mind of which that's ultimately what I'm trying to do. It's like I'm creating this model in my mind, and I'm almost trying to, in a weird way, see down like a cell level, right? Like picturing the cell and the membrane, the mitochondria, and saying, what comes to me with all this? What gestalt do I get? And where, so that we can move in the right ways. And probably if you have the opportunity to engage with that kind of data and with some experienced clinician who's worked with it for a while, you can probably get better results faster. You can get healthier faster. You can also identify where your innate weaknesses are, where you need ongoing fortification. My body when it comes to our modern environment and these exposures, my body was not suited for it in these ways. It could be catalase and glutathione function, nitric oxide production. There's a lot of things it could be, right? But so I know I'm going to go ahead and stay longitudinally on these areas of support, right? But if I listen to podcasts, then all I know is I need glutathione, I need nitric oxide, I need phase 2 boosters, I need phase 1 boosters, blah, 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 blah. It's all good information, but some people do and some people don't. So I think that's the strength of the personalized medicine, and you're tracking your data over time. We don't do just one data set and be like, okay, here's your plan. Well, maybe come back if you don't feel better. We're tracking the data. Yeah, we can see gut inflammation appears to be resolved. Gut integrity has improved. The balance and diversity of the biome appear better. Your toxicant burden is substantially reduced compared to where it was. Your intracellular nutrient availability is notably improved across all categories. The test where we infer cell membrane health, it looks better. And then you're feeling it. I have more energy, I'm sleeping deeper, all that kind of stuff. So that's personalized medicine. I think it's very valuable for those. It also takes time and it's expensive. And it's not covered by insurance for the most part. So what do we do? Well, I could tell you, because what you mentioned is we're all very similar in our design, and we're all dealing with these same circumstances, that I have learned over several years that 90% of the time we're going to do the same things, right? We're going, for every individual at intake who's never been through a process like this, we are going to place them on virtually the same detoxification protocol, almost the same gut protocol, almost the same nutrient optimization protocol, right? Like every single person, we're actually doing this. And that's where I'm like, okay, if this what appears to be, at least across the observation of hundreds of patients in a clinic, which is not a study, it's an anecdote, then we could probably infer that every person out there in our community is close to this, right? And that every person in our community, if they wanted to get healthier, on the side of what do you put into the body, not the side of what do you do for your environment, that, hey, if you ran this kind of detox once or twice a year, if you followed this kind of approach to the gut, if you use this type of nutrient support, possibly depending on age, this type of glutathione nitric oxide support, you can probably get healthy and stay healthy and avoid disease, and without having to go through all the testing and expense and guidance under personalized medicine. You can probably get 90% of the way there that the patients get by just simply following the protocols that appear to apply to 90% of the people. Did that make sense, how I articulated that?
I think it's really important to be able to identify what's dysfunctional, what's going wrong, so that you can restore the function.
I can speak to that, and again, I appreciate the fact that this is just a good conversation. It's not meant to promote anything, and that's not what I'm doing. But I think the evolution in our diagnostics that is already occurring is going to make it a whole lot better and simpler, ultimately. I do think that we're going to get to a place with multi-omics where a couple of tests could really come close in terms of the depth and comprehensiveness of the data that I already discussed, right? That can come close. You could probably eliminate it's not cheap, the intracellular nutrient evaluation. And if we can get to a place where we have a method of really understanding cell membranes through multi-omics, we can ditch that test, and we possibly could ditch the toxicant test and wait on the result of the multi-omic test to determine, do we need to do a toxicant survey or not? So there would be a way that it gets simpler as we get our minds around it's more complex in a way because we're getting deeper into biochemical flow evaluation, right? Getting closer to like a movie of the system rather than just snapshots of the system, which is really cool and really helpful. But then as clinicians, we have to adapt, and we had this discussion previously, how we get into a rhythm and it's working. The tools we're working appear to be working. Patients are getting healthier. Maybe a lot of it has to do with the tools and the diagnostics. Maybe a lot of it just has to do with the process we're discussing. People regain confidence and trust. They go, they take care of their environment, they detoxify, and they get healthy, right? And all the other stuff was actually not even necessary, it turns out. It was just dressing. But, I recently completed a theriome test as vetting it for the utilization into our clinic. And I looked forward to doing it, and I shared this with you guys because I had for months known there's something affecting my vitality. I'm not sick. I don't have diseases. My blood biomarkers look good. I'm following all my usual routines, but there is something not working for me. My system, I don't have the energetic capacities I should have for my state of health in domains, various domains of my life and work. And there was a part of me that was ready to accept that 55, maybe that, the demand pressure I put on myself is just exceeding what my capacities are at age 55. But actually, I've really cultivated a very balanced rhythm to my work and my leisure and my workouts and all those things. So I was like, it can't really be that, but it could have been. And so I completed a theriome test and said, I hope we find things. I hope we find my blind spots, because you're looking more deeply into these biochemical pathways than just with, let's say, static blood biomarkers, so to speak. These are static markers, but they're metabolites, so they're telling you a little bit more about flow. And it did. It was like my health score was not great. I'm going to acknowledge it, right? As a guy who's supposed to model health, and that's what I market, it makes me vulnerable to say I didn't have a good health score. It wasn't in the sick category, but it wasn't far from it. And also the most important thing was, as experienced as I am, and I've been doing this, and as I think I've got a pretty good intuitive grasp on things too, I wouldn't have guessed where the problems were. I wouldn't have. I was knocking out of the park on one category that I'm very attentive to, and I was happy to see that. I would have kept guessing around mitochondria and tinkering with mitochondria, saying it's got to be that's where my deficits are, because this is an energetic capacity issue. Yet my mitochondrial score was pretty good. Now, again, it's a limited lens, right? We can't just put everything in the bank on that. But then there were these other categories across the board that were not good, and I wouldn't have guessed them. Right? My liver processing isn't good. I don't drink alcohol. I have good phase 2 support. I have, as far as I know, a healthy liver. I don't have a bad toxicant burden, blah, 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 blah. And yet there it was that it's you're having a real problem. And if your liver, downstream processing in your liver isn't going well, it's going to have a notable impact on your energy. Right? And so I'll back it up and just shorten this up. Essentially, the access to a tool that is a kind of an evolutionary leap forward from the tools we've been using gave me information I couldn't have gotten to through any biometric I was using And I couldn't have gotten through my own experience and intuition around health. And it has allowed me to then develop a protocol to address those. And we'll see, right? We'll remeasure and we'll see, does it work as well as the AI says it will work? We'll find that out. I hope it does. I hope it works like a champ, because I want to recover all those energetic capacities. But honestly, I could have eventually, my body could have just healed itself. It could have found its way back into an optimal homeostatic state. It's possible that would have happened by just not having done anything. I don't know. But I can tell you that access to this tool, the data, understanding my system more deeply, is possibly, we're running the experiment now, will possibly result in a substantial change in my health status, both for now and the future, and especially my sense of well-being. And to some extent, like, even though we're talking about evolved technology, the technology that we've had previously is still good technology. And that's been doing that, right? Like, that's been allowing us to find this bad signal in people's bodies that's causing the problem. It was toxicant. It was gut. It is nutrient insufficiency. It is this, right? We've been able to find the signal and then develop protocols and see that that gets fixed. But this new technology is just looking for signal in a more granular and deeper way, picking it up.
So, what have you? Oh, sorry. Do you want to
No,
finish
I'm
that
done.
statement?
I'm done.
Oh, yeah. What have you done to be? You're very biologically informed. Actually, as far as the doctors that have come across, you're much more informed of the biochemical processes, the pathways, et cetera, within the body, and how those correlate to overall health. So, what have you done to get that type of understanding and have that intuition to where you really get it from a big picture perspective? And then from there, I want to drag that into a little bit of practicality. What do you do when you're bringing something on? What do you look for in a test that's going to help inform your clinical expertise?
Yeah, those are good questions. To the first question, I've never liked, and I don't think I'm unique in this way, having to just work off of like algorithms, disparate data points. This means this. Okay, da da da. To me, it's always got to tell a story, right? I believe that humans innately need our lives to be stories that we're involved in, right? Like, and that when we don't have that, we don't have a sense of identity, and that we don't have a sense that we're part of a story that's a story about us, but also a bigger picture story, that a role we play, that we get untethered and we're bouncing to and fro, and that's creating existential stress and all kinds of problems. For me, the health thing was always like, there's a story going on here. It's not just, the liver's not working well, let's fix the liver, or this particular. There's always a picture, like that, so to speak, that you can create of it that's like, this comes together. So early on, when I was just getting into the understanding, I mean, we're talking 10 years ago, 12 maybe, when I was still going into the hospital, and if a patient had come in with a stroke, we would assess homocysteine levels. They had not been doing that. And if they had high homocysteine, we would place them on a methylfolate with prescription. Actually, in the very beginning, we would place them on folic acid, which was really not good, but we were trying. This was a long time ago. And then we eventually started switching it to methylfolate. And then we would, monitor. And then eventually the health data suggested it didn't reduce stroke risk, and that kind of fell out of favor. But for me, I was like, okay, what is homocysteine? And then you learn it's this biomarker, right, that it's a tangential biomarker of methylation. It's not necessarily a high homocysteine or low homocysteine can have nothing to do with methylation. But you want to understand it, right? Like, why are we testing this, and why are we putting someone on folic acid to try and reduce it? So you begin and you go study that pathway, and you start studying how, the methylation pathway and how methionine becomes SAMe, and then you create homocysteine, which is a story, right? It's like a little story you can tell, right? This does this, and this becomes this. You've got a certain amount of methyl currency. It's getting jobs done all around the place, inside the body. The homocysteine in and of itself is inflammatory. It can be somewhat toxic to endothelium, so it increases blood clot risk, stroke risk, dementia risk. So your body wants to get rid of it, but what it really wants to do from an ancestral perspective is recycle it back to methionine and keep creating more methyl groups, because in an ancestral perspective, you didn't get methionine all day long, right? You basically got boluses of it when you ate meat or possibly eggs, and your body had to then create all of its methyl currency, and then that's what it had to work with and nothing else, and it had a lot of jobs to get done. So the body's orientation, the biochemical bent, is to take homocysteine and take it either through MTHFR or through oxidized choline, betaine, and recreate methyl groups through methionine, right? And it's a brilliant little loop. Like, let's just keep regenerating, but it requires obviously folate, it requires B12, it requires riboflavin, and the other pathway requires adequate choline levels, right? If your body can't do it that way, then it needs to detoxify it, which is by binding it to glycine. So my point being, not to like talk about that, is that for me to treat patients and care about homocysteine and to understand why we're modulating, I needed to understand what's the story of homocysteine, right? Like, what's the story in a human system? And so I would just go study that, right? I mean, that's just probably the answer you're looking for. I studied biochemistry. And I'd go back. I was fascinated by it because I wasn't fascinated by the biochemistry so much. I was fascinated by how the biochemistry played into the story of this patient's health and the event that they had just had, and how we were going to use it to prevent further events. So I've spent a lot of my time, my free time, studying biochemistry, molecular biology, nutritional biochemistry, tutoring under PhDs who have learning platforms for whether it's brain biochemistry, because I find it fascinating, and I enjoy it, and I take pleasure in it, and it doesn't feel like work to me. And then it's complemented because I get to go like run the experiments on real human beings in my clinics and measure it. So that's how I came to that place. Now, the second, and yeah, go ahead.
The question was, I think, exactly where you were going, which is, so having that, being informed biologically, how does that translate into what you're looking for? So, I mean, you came to Ethereum, you're interested in the test. What did you see about that specifically that interested you and said, this might have clinical relevance to me? This might really help me with my patients. And then maybe you can bring that a bit larger, where it's just like looking at generally what you're doing to look for new tests or new ways of understanding somebody.
Yeah, as you know, I was originally introduced to you from somebody we both know, who I trust a lot, who every so often just tells me to get my head up and look at this technology. And they said, this is one you want to look at. And I trust her, so we met. And then that was 6 months later that we met again. I listened to what y'all had. I looked at it. I read the little book y'all created. And then I was like, I'm not sure, right? I'm not sure how I'm going to integrate this and how is it going to change things for my clinic. So it wasn't like I was like, oh, new technology, awesome, cool. Let me just jump on it and start doing it. But I was curious. It took me a while part of it was real practical feedback around things like how your reports read and things I don't want my patients reading and stuff like that, because I'm not an expert in a lot of things. I'm a generalist, but I have some pretty good expertise in the mindset of patients and how medical test reporting impacts those, right? And what kind of trouble it creates. And you guys have been responsive to that. But a lot of it was like, man, this is a whole new dimension of testing. And how do I integrate that with the level of testing I had? Ultimately, what I came to the conclusion of is the Aristotle test is giving me access to testing biomarkers I have no other way to test right now. No other way to test. And there are a lot of individuals who you may think you don't need to go there necessarily because from an objective, like all of their blood biomarkers, everything else you're looking at looks awesome and they feel incredible and their body is probably performing optimally. Now in that individual, you would say if you ran a therium test, you're still going to find little signals. They're just probably not impacting things at a level enough to show up in other tests yet. But for high performers or health-oriented people, going ahead the earlier you detect signal and intervene, the easier it is to get maladaptive biochemistry back into an adaptive, proper homeostatic state, right? Because as you know from working with these brilliant scientists, biochemistry, just like our brain, our thinking, our emotions, biochemistry gets entrained by the inputs. Right, and so you can get into and it's constantly just adjusting to the inputs. And the role of the biochemistry is to keep you alive, right? To keep you alive and to have you be as healthy as you can be. But it can only work with what it's got. And so if the inputs are flawed in some way, things getting in that shouldn't be getting in or missing things that are really essential, the body will be brilliant at making adaptations to that issue. But what it does is that it entrains itself into a new state of biochemistry that, while it's getting the job done of keeping you alive, it's ultimately not optimal. At some point it's still going to break down, right? It's not how the system was designed to work, but it's still a brilliant compensation by the body. And in order to re-entrain biochemistry, sometimes you have to push in hard with the right information. You can't just nudge it and hope that you'll take this entrained pattern that may have been there for 5 or 10 years, and that the biochemistry will just all switch and genes turn on and off and everything will adjust because you added this one nutrient in, right? That one nutrient may be important. So what I've learned is that whether it's the nervous system in regards to energy balance, or whether it's a biochemical dysfunction, whether it's in the mitochondria or whatever, that you have to give the system kind of a shove in the direction you want it to go in, and try to get it to re-entrain to these proper biochemical pathways. Once you do, then you can kind of back out and then just use subtle signaling, proper signaling, to have the system maintain itself as it was designed, because that's really where the momentum is to just staying in an optimal state. And so, I'm talking about this in a non-PhD way, by the way. Right,
well, it's refreshing, right? I mean, we're in here with a bunch of PhDs, so.
So with Therium, I realized I'm going to be able to get down into more granular aspects of biochemical pathways. And it's not the best term, but I'm just going to use it. We're going to identify where pathways have been blocked, resulting in these compensating patterns of dysfunctional biochemistry. And if we can identify that, and we can possibly identify why, and that's still lingering, right? We don't know exactly why all the time, but with full genome sequencing added in, we might start seeing where various genetic polymorphisms are playing a role in that with age or various environment exposures. But we can understand why, then we can create these intelligent interventions that will correct that biochemistry, and people will get healthier, that bad signal will be reduced, they'll feel better. What I see at Therium now that I've had personal experience and looked at it and had more time to get my mind around that report and the interventions and kind of how I'm going to integrate it, I honestly see it as a more important test than some of the other tests. And Micah and we have no financial relationship. I'm not invested in Therium, right? Like, I don't have any financial incentives to promote this company. I'm just telling the truth that as a clinician who evaluates a lot of diagnostic technology, I believe this evolution of metabolomics, more understanding of metabolites, pathways, giving you a picture of this flow is going to be more powerful for getting people onto the right path, but not obviating still the need for some of the other data that we get, not obviating it yet, right? So at this point, it's kind of an add-on, and over time we might find out where this is good enough, comprehensive enough information that we could dismiss with doing this test or that test, or only doing that test if metabolomics suggests that test might be needed, so you get more information about the source problem going on there. But it also is stretching me, because while I might have a decent grasp on some basic biochemistry and cell biology, I am by no means like a deep expert, right, in it. And I don't necessarily always have time to become it because I'm treating patients most of the time. And with beginning to understand the metabolites that are being measured and reading about them, and then beginning to go back and blueprint them into the biochemical pathways where they play a role, and trying to get my mind around, oh my gosh, okay, so because I'm not content to just follow the algorithms of the reports, right? I am content to believe that the algorithms are reliable, meaning these are the right interventions, right? And we'll follow that over time and keep running our experiments and refine that over time. I believe that, but I still think it's really important that we're getting that story of that whole human body correct for that patient, and we're not just delivering an algorithm to them, right? These are your dysfunctional metabolites, here are your supplements, here's how you change your diet. No. We still got to be able to tell that story. So that's going to take me a while, and possibly bugging Panise a good bit to spend time with me so I can pick his brain on these pathways and stuff.
So quickly before we close, you mentioned that you need, maybe not a litany, but you need a number of tests to inform the story of the patient. So what are the other components that you view as being really essential to understanding patient biology?
Yeah, this is a great question. So we've already really kind of we talked about the subjective assessment, their story of health, their habits, their family history, all of that I think are critical. If there was some way, and I don't do this, to get more into this source issue of trauma, guilt, and shame that might be like permeated into their health story, I think that would be really good. But that would really require someone trained in psychology and cognitive behavioral therapy or a licensed counselor, which would be cool if you could bring that on board and make that part of your intake. So there's all of that aspect about that human being. So you're knowing them as a human being, right? Not just a biological entity.
Yeah.
I personally find the DEXA scan, it's expensive, so I know it's not feasible for every clinic, but I think it's incredibly valuable because people, Mikey, I think you're in pretty good shape. But a lot of guys like you that look like you come in and they get on the DEXA scan and they find out they're 30% body fat, right? And it's like a mind blow for them. Right? Like they're like, how can this be? And then the amount of visceral fat that they have and blah, blah, blah. So the DEXA scan, where we can precisely measure body compositions and lean mass and track those over time, I think is a really helpful tool if you can afford to have one in your clinic. And patients love it. And if you're treating patients in our population right now, you probably are addressing body composition. And if you're not, you should be. Because most of the people who come to see you, if they've got, especially if they're not in great health, have excess unhealthy body fat and often are under muscled. And you need to have protocols to help them improve body composition so that they can improve their lean mass, drop their fat mass, and become metabolically more healthy. That's critical. Like if you're not attending to that, that's like a foundation block of healthy aging.
Everybody wants to look better, so it's like an easy play into the, hey, you not only feel better, you'll look better.
Yeah, and with DEXA, it allows us to really index that correctly and measure it over time and prove that we're getting there. I like the ability to just objectively look at the endothelium with carotid intimomedial thickness screening. Those are inexpensive devices, butterfly ultrasounds, and the software is not expensive. This is not an expensive investment to make as a clinic. It's very easy to learn how to do it in your clinic. You don't have to have a tech trained. A clinician can learn to do this. And you're able to, obviously you're looking for plaque and flow, but you're not really, this isn't a test to say, okay, do we have 80 or 90% obstruction of carotid artery? Do we need to send you for a carotid endarterectomy? You've had strokes. This is a test to identify intimomedial thickness and characterize small plaque deposits, because you're able to really get an idea, is the endothelium under stress, or has it been under stress in the past? And is it actively being damaged? Are we at risk of progressive arterial disease? Even though you wouldn't qualify as arterial disease right now, you've got an endothelial problem. And we've got little protocols where we approach the endothelium that are really quite effective, where you can remeasure 6 months later and show that the intimomedial thickness has reduced, it's gotten thinner. That means that subendothelial compartment isn't getting inflamed and starting to plaque up. And then over time, you can also measure and show that soft plaque deposits have become calcified and they've healed, and that there's not new soft plaque deposits. So I really like that ability, because metabolic disease and arterial disease are still the big movers right now, and they're often the disease behind the disease of cancer and autoimmunity and many of the other conditions. Not always, but often. This is, I could be wrong. This is my opinion, but ground zero of cell health is cell membranes. Right, including mitochondrial membranes, peroxisomal membranes, and then the ability to take in and utilize and distribute energy, right? Metabolism, right? The ability to actually create energy and dispense of the byproduct of that energy, the cellular exhaust, so that you're not creating excessive oxidative stress. And then the ability to get blood flow to the cells, right? The endothelial function. So those things are just foundational, and most people who aren't haven't been on a path of optimization, who come into your clinic, if you're looking deeply enough, you're going to see all kinds of bad signal there. You may not see high blood glucose yet. You may not even see high insulin yet, but you'll certainly see lipid particle fractionations that are insulin-resistant patterns. You'll know that person's insulin-resistant. You'll see excess visceral fat accumulation. They may not even be that heavy, but they'll have excess visceral fat. And then you'll see often, and correlating with that, little markers of endothelial dysfunction, oxidized lipids, elevations in HSCRP, which can be due to something else, of course. You'll see thickened up IMT, soft plaque deposits. And so you've really got to start there with human health, is improving blood flow, metabolics, the ability to use and distribute and dispense with the byproduct of energy, and membranes. If you're not doing that, then you're kind of skipping the foundations of how the body was designed to work well.
Well, I appreciate your time today. Thank you so much for just sharing your knowledge on how people work and how, as clinicians, they can get hopefully more effective at driving those patient outcomes.
Yeah, Micah, thank you. It's a real honor. It's always an honor to get to talk to my colleagues and fellow professionals, so I really appreciate the time.